Time now 6:44. Well, as we've been telling you, Dr. Anthony Fauci is warning of a surge on top of a surge of new COVID-19 cases after the Thanksgiving holiday, a grim prediction for the rest of the holiday season. Locally, as it stands now, according to Austin-Travis County Public Health, 332 new cases were reported yesterday. You can see the spike there on that blue bar graph. That dark blue line shows the 7-day average with a slight uptick at the very end. Austin Mayor Steve Adler joins us now to talk about the impact this could have locally. Mayor Adler, thanks for joining us this morning.
Thanks for the invitation.
So I know that you, health officials, and others were really driving home the point that we needed to stay home for Thanksgiving, but at least anecdotally, at least, it appears that a lot of people weren't listening. That Austin airport report about the busiest day since the pandemic, it was just on Sunday, more than 12,000 people flying out. So what kind of a surge, if any, are you expecting after this Thanksgiving?
We don't know, and we anticipated that a lot of people would be around other people on Thanksgiving. The goal was to drive that number down as low as we possibly could. We don't know what it's going to look like, and we're not going to know for another week to 10 days. Our fingers are crossed that it's not going to be significant surge on top of a surge. But again, we don't know. We just have to be prepared. You know, this community does have a lot of control over what happens to us by our behavior. And people are wearing masks a lot in this community. We've actually driven the numbers down here over the last several days, and we don't know yet if that's because people during Thanksgiving just don't want to go to the hospital when they should, and if they should actually go. So it's kind of a wait and see situation where we're poised to act, but urging everybody in the meantime, if you went away and you were around other people, please get tested. If you went away and you were around groups of people, please stay home for 7 days is what we're asking people to do to see if that virus manifests.
Yeah, and that's the other problem with that, is that it's very difficult, as you know, to get people to do that and stay at home for 7 days and quarantine themselves. So we'll keep our fingers crossed on that and hope that everything works out. Austin-Travis County right now, we're at a stage 4 in that COVID-19 risk-based guideline. It only goes up to stage 5. Do you see that increasing to stage 5 anytime soon?
Again, we don't know the answer to that, but what we do know is as a community we can control that. We went to stage 4 orange. We went there a little bit early, urging people to not be in groups, urging people to wear masks anytime they're out of the house around people not in their family unit, even if it's friends or other family, because we're trying to avoid going to red. That's our best chance of keeping businesses open and schools open, which means we have to show that level of discipline. But we're looking at cities and states all over the country, parts of Texas, where the communities are not doing the discipline thing, and they're paying for it right now. And Austin can and should do better. We need to do better.
We certainly don't want to get to the point where our hospitals are taxed. We just read a story this morning about how in Austin it's about 9% right now with COVID-related hospitalizations. If we get to 15% for a certain period of time, then that's going to be trouble. So is the convention center still prepared to be an overflow hospital just in case that sort of thing happens?
The convention center is prepared to take low acuity cases to free up space in our hospitals if we need it, and we'll see that number of percent of occupancy in our hospitals with COVID patients is right now in Austin among the lowest of any big city in the state. A lot of cities are above the 15% that the governor said requires more drastic action. Let's keep our numbers low. Let's keep the number low so we can keep schools open.
Let's talk about some promising news, and that comes in the front of vaccines. There are a few vaccines right now that may get green-lighted. The Pfizer one, at least, may be green-lighted within the next week or two. So how does Austin go about securing the vaccines that we need in our community? Because obviously this vaccine is wanted all over the country, all over the world.
It is wanted everywhere, and the distribution of that is primarily going to be set at the national level, and the CDC guidelines with respect to who gets that. You know, they're going to start shipping that, I think, in December, within days of getting the approval, if that approval comes. 2 vaccines up for approval in December. We could have 2 different kinds of vaccines getting here in December. They're going to go first. We're not going to get very much of it. Very limited supply. So we're going to give it to the frontline healthcare workers that are in and around people that are infected, because they're the ones that are most at risk, and we need them, frankly, to stay healthy for the rest of the community. And then over time, you're going to start getting it out to first responders. You'll start getting it out to the people among us that are most susceptible and vulnerable. But it's going to be, you know, into the first half of next year. Some people are saying the fall, before it gets to everybody that wants the vaccine. That is both really close and still far away. I like to look at it and say we're close, which is why we just have to hold on with the disciplining with masks. No one wants to be the last person to get sick. We have to hold on a little bit longer. We have some of those monoclonal antibodies coming into town now. We don't have a lot of supply of that. So it's being given to people that get infected but are the most at risk on getting infected. So there are a lot of things that are coming to us, the treatments, the vaccines around the corner. We just have to hold on a little bit longer as a community.
And let me ask you how that works, how that process works, because these are so sought after, these vaccines, and because everybody needs them all over the world. What do you do as the mayor? I mean, do you lobby with the governor or somebody on the federal level to say, hey, you know, we could use this much, or can you get us this or get us that? How does that work where you can make sure that we get recognized as a community here too?
We're certainly lobbying, although I'm not sure that it's going to do any of us mayors any good to actually be lobbying, because the rules that set out the distribution of that vaccine are going to be sent nationally and uniformly applied across the country. There may be some discretion at the state level as the supplies are coming in. That's unclear at this point. But we have stood up in this community right now a regular weekly meeting of about 150 stakeholders that are involved in the distribution of the vaccine, and has been meeting for some time now. So we're both anxious to get our share of the supply, but setting up the systems so that when it does come into the city, we're able to, and it's been found to be safe, we're able to distribute it.
Also, Mayor Steve Adler, thanks for joining us here on Daybreak this morning. Have a great day.
It's good to be with you. Thank you.